Welcome back to my channel. So in this video, we're guiding you on when to investigate for sexually transmitted infection. So maybe for example now, you suspect you have sexually transmitted infections. The first thing you need to do is to examine yourself. If you suspect maybe you come or you have sexual contact with a particular person which you think the person have sexually transmitted infection, if it's in case of bacterial infections, please you have to wait like 2 weeks before you go for a laboratory test. But if you are suspecting HIV, what I will advise you to do is to try to see your doctor if there is any prophylaxis treatment they can give to you, because there's no any test that can show either if you have contracted HIV within 2 to 3 weeks of the first contact with the infected person. Having said that, in case you want to investigate for sexually transmitted infections, is when number one, maybe you're experiencing unusual discharge, that is offensive discharge. There is normal discharge, which know that maybe sometimes if you're in ovulation, you see some discharge, small things comes out. These are normal discharge. You're experiencing heavy unusual discharge. Number two, you have itching. You're experiencing itchings in your private part. Number three, your menstrual cycle is not regular. You're having irregular menstrual cycle, and or you have completely ceased your menstrual cycle completely ceased to come, and you are sure that you are not pregnant. But often sometimes I will advise you to get yourself tested for pregnancy if you didn't see your period, or you're having some issues with your menstrual cycle. Get yourself tested for pregnancy. If you're not pregnant, then you can proceed to have for you can proceed to do uh, infection test. When you go to laboratory, you will tell them you want to do MCS. That's how it's abbreviated for. But the full meaning is microscopic culture and sensitivity. And this test, they will collect two samples. Mostly for the females, they collect two samples. Number one, they will collect what we call HVS, which is high vaginal swab, and urine sample. But in some case, sometimes maybe your doctor, if you meet a health personnel and they can examine you, maybe he's suspecting something within the cervix, he can collect sample from the cervix. The procedures are there. It is advisable for medical health personnel to collect the sample. That is the best way, because there's procedure in collecting this sample. If you watch some of my videos, or one of my videos, I said microorganisms are ubiquitous in nature, they are present everywhere. So any slightest mistake or using your hand to touch the tip of the swab stick can introduce infections. And if the unsterilized container is used to collect the sample, it can also introduce infection into the sample. At the end of it, you're going to be given false result. Most of the people sometimes go home with false result. Maybe they don't have infection, or it's something else is affecting them because the process they collect the sample is not proper. So having said that, what is the importance of investigating or doing this MCS? The most important of doing MCS, number one, it helps to isolate which of these microorganisms that is affecting you. Number two, it will give out sensitivity. What means sensitivity? The drugs that will work for that particular infection. Maybe for example now, because sometimes your system may be resistant to one or two drugs because of the frequent use of those drugs. So when you do microscopic culture and sensitivity, it's going to determine which of these drugs your system is not yet resistant to. Then you go for that particular drugs. That's the important one of the advantage of doing microscopic cultures and sensitivity. And if there are no infections in your system, the result will come out plain that there are no infections. If there are infection, it will come out. Because some, if you go, like some people, sometimes they can go to labs, a medical doctor requested for maybe VDRL, which is for syphilis. You can only isolate only that one, syphilis, which they will use blood. But microscopic culture and sensitivity will isolate any types of infections, mostly bacterial infection. And if you want to isolate, if you want to do that of fungal isolate, if you have fungal infection, you tell the laboratory personnel, they are going to work on it to do that. So there are different mediums of which they use in isolating those things. The only thing which they don't investigate is viral infections. Most of the viral infections have no treatment, like HIV, hips sometimes don't have treatment, it go on its own. So the best way you can get to safe treatment of sexually transmitted infection is for you to go for microscopic cultures and sensitivity. The cultures will give you the drugs that will work for the best drug that will work for you. And when you take the drug or the injections, you're going to be fine. Stop going to chemists and get the drug. Some of these drugs sometimes the works they did is to, you know, chase away the sign and symptom, whereas the system goes into the body and start destroying the system, of which I've mentioned several times in one of my video. So thank you for watching and see you in my next video. Bye for now.